We all tend to know what general things are good for us and which are not so good. But when things are really not that bad, it's easy to convince ourselves that it's no big deal. Not worth making a big thing out of. I hope to change your mind about that and get you excited about the huge benefits of small changes. You're listening to the Health Courage Collective podcast, episode 158, Reduce Your Health Risk by 78%. Welcome to the Health Courage Collective podcast, the show for women who are too busy to slog through hours of generalized, inapplicable, and often contradictory health information, but too smart to ignore that a few minutes of focused attention now can prevent years of suffering in the future. I'm your host, Christina Hackett, a pharmacist who doesn't want you to live on prescriptions, a certified coach specifically trained to maximize your potential, and a compulsive learner obsessed with preventative, cutting-edge, holistic, and integrative medicine. I'm on a mission to increase your physical and mental resilience so you can fearlessly look forward to your next 40-plus limitless years. Your time is now. Let's go. Hi there, and welcome to another episode. I hope you are doing so well. How is your gamification? Did you decide to boost your motivation by gamifying a health behavior? Did learning how playing a game means giving away your agency to the game maker help you decide which games you actually want to play? Today we're going to talk about another way to think about health measurements and behaviors. If you're a smoker or former smoker, the summary of smoking's effect on your health and estimated long-term risk of lung cancer, emphysema, and cardiovascular disease is described in what are called pack years. To calculate pack years, you multiply the number of cigarettes smoked per day by the number of years smoked. So smoking 20 cigarettes a day, which is a standard pack size for 3 years, is a 3-pack year smoking history. And smoking 5 cigarettes a day for 12 years is also a 3-pack per year smoking history. Makes sense? It's not perfect, but it does seem that the biggest factor to consider is the total lifetime exposure to cigarettes. 5 weeks ago in episode 153, we talked about your exposure to PM 2.5 air pollution particles. That's important to know. It's important because your risk of all kinds of chronic diseases, especially in the family of cardiovascular disease, goes up with increased PM 2.5 pollution exposure. And a part of why chronic diseases become more common the older we get, and even more so why our immune system doesn't function as well as we get older, can be because of our lifetime exposure to PM 2.5 pollution particles. The number of times you're exposed to PM 2.5 pollution and the duration and intensity of those exposures all play into the long-term consequences on your health. Every exposure matters because it all contributes to your lifetime exposure. Lifetime exposure to radiation is also tracked and matters to our long-term health. Lifetime exposure to estrogen is also often considered in studies, but in that case, a lot of times, the higher it is, the better. I think these things make a difference, and that making sure you never smoke one more cigarette matters because it adds to your lifetime exposure. Doing everything in your power to decrease your exposure to poor air quality, even on a single day, matters. Minding your radiation exposure has an impact on your long-term health because it all contributes to your lifetime exposure. But for whatever reason, I hadn't really thought about lifetime exposure to other longevity metrics in the same way until just recently. So I hope this is helpful to you and your mindset too. Let's make sure you get to your 80s and beyond in good health, shall we? So there's this thing called the atherosclerotic cardiovascular disease calculator. The American College of Cardiology and the American Heart Association both recommend that clinicians use the calculator to estimate the 10-year risk of stroke and heart attack for patients ages 40 to 79. You can find the calculator all over the place online and plug in your numbers if you know them. It asks your age, cholesterol numbers, blood pressure numbers, and whether you have diabetes. The problem is that the biggest driver of the 10-year risk is age. So when you're in your 20s, there's almost no blood pressure or cholesterol level high enough to predict a heart attack or stroke within the next 10 years. And when you're 80, there's almost no blood pressure or cholesterol level low enough to not predict a heart attack or stroke in the next 10 years. But when you care about lifetime exposure, rather than just this 10-year risk thing, everything changes. I for sure don't want you to have a heart attack or stroke or other life-threatening or debilitating illness in the next 10 years. But I also don't want you to have one in 30 years either. It's all about knowing the game you're playing. Are you playing the 10-year game or the 40-year game or the 50-year game? I like that one even better. The biggest predictor of heart attack or stroke is lifetime exposure to high blood pressure and or lifetime exposure to high ApoB lipoprotein particles, which are attached to some LDL cholesterol particles. I have a lot of thoughts about cholesterol management and treatment, but for today, let's just say that a high lifetime exposure to ApoB particles is a predictable driver of cardiovascular disease. I think everyone knows that having high blood pressure or an unfavorable cholesterol profile, whatever that may mean to you, which is radically different to different experts, is not so good. We all know it's not great, but there isn't a whole lot of urgency to take corrective action because the risk still seems low. Because it is. If our blood pressure is 125/85, it's not that big of a deal. It's not crazy high, which is true, it's not. But it doesn't mean that it doesn't matter because we're not playing the today game or the 10-year game. We're playing the 50-year game. And in that case, it matters a lot. I'll put a link in the show notes to a very well-written article by Dr. Peter Attia that lays out all of these facts in deep detail. If you're feeling it, jump neck deep into Mendelian randomizations and get down with your bad self. It's a good one. Dr. Attia explains how from ages 70 to 74, death rates per 10,000 people from cardiovascular disease and from cancer are 58 and 73, respectively. So pretty close. At the ages of 95 to 99, death rates are 1,013 and 182, respectively. That is crazy. The longer you live, you become 10 times more likely to die of cardiovascular disease than cancer. So doing something about it is a must for forward-thinking people like you. A big Mendelian randomization study showed, with all of the detailed charts and graphs and bells and whistles that you can find if you click on the link to the article, that a reduction in lifetime exposure to high blood pressure and lifetime exposure to LDL-C particles reduces cardiovascular events like heart attacks and strokes by huge amounts. Again, it's the reduction of total lifetime exposure. There's some nuance to it, but basically the reduction of systolic blood pressure, that's the first number or the top number, of 5 millimeters of mercury over a lifetime, and a reduction of LDL-C by 22.4 milligrams per deciliter over a lifetime reduces risk of cardiac and vascular events by 53%. 53% is huge, and it does seem to track that reduction by 1 millimeter of mercury and 5 milligrams per deciliter also makes a difference, just not quite so big. And each one, independent of the other, reduces risk. 10 millimeters of mercury blood pressure reduction over a lifetime alone reduces risk by 45%, and a reduction by 38.7 milligrams per deciliter of LDL-C alone over a lifetime reduces risk by 54%. Extrapolating the data shows that doing both of those things, both reducing your blood pressure and your LDL-C, reduces risk of cardiovascular events by 78%. That's like as close to a guarantee as you're ever going to get. That's so crazy, it's almost unbelievable. 78% risk reduction. Who wouldn't want those odds? But it's true because it's not just from better physiologic function today or for 12 months, but over a lifetime. The epithelial cells that line our blood vessels are susceptible to both mechanical damage from high blood pressure and chemical damage by inflammation and high levels of sticky LDL-C or ApoB lipid particles. So lowering the risk of damage every day for a lifetime matters a lot. This means that those numbers, even if only slightly elevated, still matter. 1 millimeter of mercury matters. Members of your healthcare team might not be overly concerned because you're not going to stroke out today. And maybe your ACVD calculator score isn't bad at all. But you're not playing the today game or the 10-year game. You're an elite contender in the game of life. You're headed for millionaire estates, not countryside acres. You're in it to win it. You visit your in-laws, win the talent show, learn sign language and CPR. Maybe you're even going to find a buried treasure or inherit a skunk farm. You plan ahead and you care about way more than just short-term risk. The stress to your endothelium from 1 millimeter of mercury higher blood pressure and 5 milligrams per deciliter high ApoB cholesterol matters. And other seemingly little things matter too when you're playing the long game. Lifetime exposure to chronic low-grade inflammation matters. This can come from a leaky gut, which you might not know you have. I believe that your lifetime exposure to processed food matters. We do know that it takes around 2 years to change out the oils in your cell membranes when you start eating different fats. So lifetime exposure to the kinds of fats that cause your cell membranes to perform poorly matters. One basket of fried food matters, but the fewer fried foods you've eaten in your lifetime, the less of an impact one indulgence food will create. I also believe that your lifetime exposure to insulin matters. You'll die without it, of course, but when you have higher than optimal insulin levels, poor physiologic functioning will result. The bigger your lifetime exposure to high levels, the worse your long-term outcomes will be. One blood sugar spike after a starchy meal matters because it adds to your lifetime exposure. Very slightly elevated insulin levels matter when you have those levels for 20 to 40 years. Hey, I wanted to briefly interrupt to ask if you're curious about female bioidentical hormone replacement therapy, the kind that's usually started around the time of perimenopause. What it is, what it does, how it works, what it's like. If so, you should check out my Udemy course called The Basics of Female Bioidentical Hormone Replacement Therapy. The course goes over the pros and cons of using hormone treatment, which hormones are usually included with BHRT, how they're used, the lab tests that are used, some tips for finding a prescriber in pharmacy to work with, and how to develop a rough estimate of how much BHRT will cost you. If you've been wondering whether bioidentical hormone replacement therapy is right for you, it's time to close that open loop, stop wondering, and move forward with confidence. Enroll in my course today. As a listener of the podcast, you can get a special discount for the very best price. It's a no-brainer. I would just tell you the coupon code, but Udemy makes me change it every month. So check the show notes or go to www.healthcouragecollective.com/Udemy to find the special podcast listener discount code that's only for awesome people like you. Okay, back to the episode. I also think your lifetime exposure to sleep deprivation matters. Matthew Walker points out the immediate effects of losing just 1 hour of sleep in his awesome book, Why We Sleep. Accident rates and heart attacks go up significantly when we all have to spring forward for daylight savings. But sleep deprivation effects get even worse over time. The more nights you're underslept, the higher your chances of weight gain, diabetes, cardiovascular disease, heart attack, stroke, depression, attention deficit, poor immune function, and poor overall quality of life. I believe that your lifetime exposure to sitting matters. We know that sitting is the new smoking, so I think that we should all have to report our chair year history on our health forms, like a pack year history for smoking. Maybe I could become a lobbyist for this issue. Chair year history, are you guys on board with me? I think it would actually tell people a lot. Exposure to sitting deteriorates your body the way exposure to spaceflight deteriorates your body. It deprives your body of the benefits of gravity. We talked all about it in episode 83, so you can listen to that one for more info. Do you remember the way to prevent that lifetime exposure from being so detrimental? Gold star if you know that all you need to do is stand up from your chair every 20 to 30 minutes. That's it. That interrupts the onset of decrepitude, and then you don't have to have such a big chair year history number, because I'm sure you were really worried about that. But you should be, because it really does matter. I'm sure you can think of some other lifetime exposures that matter. Unmanaged stress, traumatic events, overbreathing. I'm just hoping that thinking of more things in terms of lifetime exposure helps you see how much little things matter. 1 millimeter of mercury more of blood pressure over a lifetime makes a measurable difference, like whether you're going to have a heart attack or not. I believe that 20 minutes less of sleep every night over a lifetime matters a lot, and 40 minutes more of sitting every day over a lifetime matters a lot. These little things matter when we take the lifetime view. Honoring the lifetime importance of little things also matters because it affirms our identity as a smart and forward-thinking lady who is aging at an elite level. We don't settle for average. We care about more than just today or even 10 years from now. I also believe that our lifetime exposure to clean air matters. Our lifetime exposure to meditation really matters. Our lifetime exposure to a healthy holobiome matters. Our lifetime exposure to new ideas matters, to healthy relationships and nutrient-dense foods and healthy fats, to doing what we said we were going to do when we said we were going to do it, whether we felt like it or not. Our lifetime exposure to movement matters, both to training and to just not sitting still. Our lifetime exposure to doing hard things matters, to stepping out of our comfort zone, to feeling our emotions instead of trying to push them away. There are tons of others. Some are my theories, and lots of them are backed by studies like lifetime exposure to saunas, exercise, and mindfulness. I'm hoping that you remember the importance of your lifetime exposure to tiny increases in blood pressure and ApoB cholesterol particles, because that's huge, but also that you consider your lifetime exposure to other things and how a tiny improvement regularly over time can have massive effects on your quality of life in the future. Sure, I know you can handle ever so slightly suboptimal circumstances, but what is a lifetime exposure of them going to cost you? It's worth it to be picky and put in the effort to make tiny improvements to get from okay to optimal, because you deserve it. I'd love to help you get to where you want to be and have fun along the way. Thank you so much for being here today and for caring about your lifetime exposure to little things that can possibly decrease your ability to make a difference in the world in the future. Next week, we're going to get rid of some stuff together, so be thinking of a personal habit or issue or pattern or problem that you're truly ready to get rid of. And we're going to push it off a cliff next week. Until then, be a winner at the game of life, head toward millionaire estates, report your year history to your healthcare team, turn up your nose at the 10-year game, and don't be normal. Thank you so much for tuning into the Health Courage Collective podcast. I am truly honored that you have paid me the enormous compliment of your time and attention. I would be so grateful if you would share this podcast with someone you know and subscribe so you never miss an episode. This podcast is for entertainment and information purposes only. Statements and views on this podcast are not medical advice. This podcast, including Christina Hackett and producers, disclaim responsibility for any possible adverse events by use of information contained herein. If you think you have a medical problem, consult a licensed